Hello again, everyone. My name is Marty Guthmiller, and I'm CEO of Orange City Area Health System. Welcome to today's COVID-19 Community Briefing, 12th edition. We come to you today with heavy hearts over the loss of Randy Jacobsma over the weekend. Randy was our board chairman for the past 6 years. He had been on our board for a total of about 20 years, and Randy's contributions to us are infinite, really, and we greatly are saddened by his loss. But in true fashion of Randy, he would want us to get on with things, and so we're trying as best we can today. It will be up and down for a few days, weeks, months, even as we reflect back on Randy's leadership, what he has meant to this organization, what he has meant to this community, and certainly what he has meant to his family. So we send our sympathies to Melinda and her entire family, and we will miss Randy very, very much. I'm not sure it's possible to transition after that, but we are going to try. I'm going to transition to our scoreboard that we have typically provided for you, and that is as follows. We have 68 tests that have been performed here at Orange City Area Health System. 3 of those positive, again, not a positive case since April 2nd, and 65 negative cases. This morning we did learn that there has been 1 additional case in Sioux County that was identified, and so I believe that brings the total in Sioux County to 8 as of Monday morning. I want to talk just briefly about the testing, the antibody testing that we have out there, and a little bit of caution with regard to that, and that is that certainly the IgG test tests for antibodies to the coronavirus, but it is a coronavirus susceptibility or antibody that is tested, not necessarily the SARS-CoV-2 variety. And so a little bit of caution with that. It's better than nothing, but it does not test for true immunity to the COVID-19 disease that we have. More on that in the future, but I just wanted to relay that to you as well. I want to talk in a little more depth now about the governor's proclamation on Friday regarding quote unquote opening things up for elective surgery. We are expecting some guidance on the proclamation through the Iowa Hospital Association that is in sync with other states across the country that we've been studying as well, and I know IHA has also, that takes governor's proclamation and kind of operationalizes it, if you will. And so we're anticipating that guidance soon from IHA, but I'm going to run down a little bit of some of the categories that will certainly be in the IHA guidance, and it gives you a little better idea that simply saying to opening things up again is a little easier than actually doing it. And so here are some of the things that we're going to be working on in earnest beginning today and getting things going. Personal protective equipment. We have to make sure that we have adequate inventories, and we have to conserve PPE inconsistent with the guidance provided by the CDC and the Iowa Department of Public Health. So we have to continue to be protective of our PPE. Capacity. The governor's proclamation talked about we need to maintain adequate capacity in our hospitals in the event of a surge or outbreak of COVID-19. And there are some specific requirements for that, and we will make sure that we comply with all of them. One of the more complex areas is in the testing of this, and the governor's proclamation states that a hospital or provider must have a plan for timely COVID-19 patients testing symptomatic or symptomatic patients for COVID-19. Well, we will certainly have that, knowing that the vast majority of our patients will be asymptomatic. And so what do we do in those cases? Again, we need a plan for that, and we will have a plan for that. One of the shoulds that the governor has is that there should be a negative COVID-19 test performed within 48 hours of surgery. That is not always possible. And our state hygienic lab does not always test asymptomatic patients. And so we have to be cognizant of that. And we also have to have, per the proclamation, a plan for proceeding with a case in lieu of not receiving the 48-hour test. And so we will try to do that. We will try to comply with that. And that's in the spirit of what the governor, we believe, is saying. Responsible start. We should have a prioritization policy committee. In other words, which cases do we start with? How do you get ramped up? How do you begin? And we will have a prioritization policy, but again, it takes a little bit of time to set up that structure. We should have a phased-in approach, and I'll just read out of an anticipated wording that we're going to get here. An example of a phased approach based on surgery or procedure type would be a plan to begin to schedule and perform surgeries and procedures that have a minimal to low impact on inpatient hospital bed capacity and utilize minimal amounts of PPE with the intent to expand to additional surgery procedures over time. So the explanation or the behind the scenes stuff that's going on with the governor's proclamation is to perform only those surgeries that have minimal, if any, impact on inpatient capacity, and perform those first that have as minimal of an impact on the use of PPE as possible. So again, it takes a little time to figure out which of those cases fit those categories and how we will comply with that. Regardless of the specific approach that we take, expanding to the next phase is going to be an important part of our plan. That will always be done in context of what's going on around us. So if there's more activity around us, we'll probably be backing off the gas, so to speak, of doing more cases, and probably be cognizant. If around us remains quiet on the Western Front, as I've been saying, then that'll be one indicator that we're able to go into the next phase of surgeries. Finally, a plan for phasing in elective cases must also include identification of trigger points that would cause us to pull back and say, well, wait a second, we're going to stop. And so we'll identify those trigger points. Again, maybe an outbreak in the area, maybe all of a sudden an identified shortage of some type of PPE, something that changes that environment. And so we'll always be cognizant of that, but we actually have to have a plan that specifically points that out. Again, we talked about a prioritization committee. That committee will likely consist of surgery staff, anesthesia staff, and nursing development or nursing administration staff. This will not be simply decided in a room with administrators, as an example. This will actually be developed in concert with clinicians. And so the notion of conveying safety to patients is paramount, and we want to make sure that those things are followed. There's also some environmental issues that we'll be dealing with and have to make sure are in place before we expand elective procedures. Generally speaking, these environmental facts say that providers should demonstrate that we are adhering to the social distancing and relevant Iowa Department of Public Health and CDC guidelines. In other words, all the things that we're doing now, we need to make sure we continue to do and make sure that we are communicating that to our patients and the people that accompany them. We must have a process in place to screen patients. Not a problem, we're pretty much doing that now. We must have a process in place to screen all staff and visitors. Not so much of an issue, we're doing that now. Protective equipment and supplies should be worn and utilized as necessary to ensure staff and patient safety. Again, pretty much using that now. We just have to be cognizant of our reserves, make sure that those supplies remain available. Eye protection, all staff will be wearing eye protection in these elective procedures, again, for their own protection. And all patients and companions must wear mouth and nose coverings. Again, not a lot different than what we're doing right now. So, but we need to emphasize that we have a plan, that we have signage that points all of these things out, and that is all very appropriately communicated and being responsible where we are. Also, one of the things that we benefit from here just physically is that these areas need to be distinct and separate from the emergency department or any ICU area. Most of you familiar with our physical facilities here is that our outpatient, our surgical waiting area, and same-day procedure area is completely distinct and about as far away from our ER as we can have it, and certainly not near our patient wing, our med-surg or ICU wing either. Even things like waiting room chairs will need to be spaced and so that we promote appropriate social distancing. Finally, again, we talked about the governance structure of the internal committee. There has to be a formal internal governance structure to oversee these criteria and principles. Most likely that would be our incident command group that has been studying this and in the trenches all along the way. They are the most informed at all levels of what's going on and would likely be a key part of the governance structure, maybe with a couple clinicians again on that. So that's a little bit in the weeds with regard to what the governor's proclamation yielded on Friday. So technically it went into effect Monday morning, this morning at 5 a.m. As far as we're concerned at this point, we haven't done anything in conjunction with that. We're continuing to operate on the pre-proclamation verbiage that the governor had, but we will soon be rolling out these new protocols. Hopefully that gives you a little bit of insight into what's going on and maybe provides us with a little more patience from you relative to getting these things going. We want nothing more than to rev up the engine again and take care of patients and get things going. We just want to do it safely for both staff and patients, and certainly legally in compliance with the governor's proclamation and what's going on around in our area. Again, we believe that our facilities are as safe as any place today. The disinfecting that's going on, the hygiene that's being practiced, it's as safe a place as you could be other than probably your own home. But in some cases, I might argue with that too. So we encourage you to come back. We encourage you to use our services and certainly be very careful to maintain your health maintenance kinds of things. So we can stay on top of any conditions you might have. That's going to be it for today. I just want to remind you to stay vigilant, stay strong, stay healthy. Thank you for joining us.